CBD vs. THC for cancer treatment. Cancer is one of the most frightening words you can hear your doctor say, and unfortunately, almost 2 million new cases will be diagnosed this year in the United States, and a projected 606,000 people will succumb to the disease in 2020. Those numbers are truly scary, but thankfully science has given us remarkable new treatments that have shown to drastically improve the patient's chances of beating the disease. On the other hand, these treatments can sometimes bring down the quality of life for the patient while battling the disease. However, more and more people are turning to the use of THC and CBD for credible cancer treatment options. What is the difference? In this article we will examine CBD versus THC for cancer treatment. What cancer really is. There are many different forms of cancer, and for the vast majority of people in the United States and the world have either had cancer themselves or know someone who has battled the disease. Even though cancer is prevalent, few actually know what the disease truly is. Essentially, cancer is caused from overactive cells reproducing at lightning speed within the body. Overactive cells reproduce enough to cause tumors in various parts of the body and can impact organs and all tissues throughout the body as well. THC for cancer treatment. Many people tend to avoid THC as it's the substance in the cannabis plant that produces that euphoric feeling associated with recreational marijuana use. In some states, THC substances remain illegal, but that might soon be changing as more studies about THC's effectiveness on cancer cells comes to light. Although THC is not a complete cure for cancer, the substance has shown proficiency in inhibiting cancer cell growth throughout the body. Much of the clinical studies have been performed in mice, but its use has been noted in human patients as well. Essentially, those that take THC can potentially see a drastic reduction in cancerous tumors within the body. CBD for cancer treatment. CBD is by far the most popular when compared to cannabis substances. Its popularity is driven by the primary fact that it does not impair the patient's judgment in any way. Traditional treatment for CBD includes depression, anxiety, and other mental concerns. However, CBD has a profound effect for cancer treatment as well. Where it does not impact the size of a tumor or cancer cells, it does help alleviate pain, nausea, and vomiting that can be associated with cancer. Use them together for best results. Where both CBD and THC have their own individual cancer-fighting benefits, when used together, they can potentially produce the best results for the patient. Essentially, THC could be used to treat issues associated with cancer, depending on the type of cancer, and CBD may help alleviate pain, anxiety, depression, nausea, and vomiting. Studies are still currently being performed on these two powerhouse cancer treatment options, but currently, they have been used successfully on hard-to-treat cancers such as pancreatic cancer. Current studies suggest that when THC and CBD are used in accordance with chemotherapy in pancreatic cancer patients, the patient can live up to 3 times longer than those who do not utilize this combination. On average, a pancreatic cancer patient will live 5 years. Use of THC and CBD can potentially provide a substantially longer lifespan to the patient. CBD and THC are among the most natural cancer treatment options, and for patients who will undergo chemotherapy, and their use can make the process a lot more effective and comfortable for the patient. Additionally, in certain cancers, these two substances can potentially completely negate the need for chemotherapy treatments at all. The effectiveness of THC and CBD for potential cancer treatment is staggering to say the least, so if you or a loved one are impacted by cancer, trying the natural approach to help heal your body may be an option.